All right, so for Lab 9, we're going to be going over exercises for the lower extremity. And with any rehab, you're going to want to talk about and think about what phase of healing are they in, what's their medical history, what injury they're dealing with, because that's all going to dictate how you're going to write out their rehab. So generally speaking, we've talked about this a little bit, but rehabilitation protocols usually start at the beginning with just range of motion, early, maybe a little bit of early strength. Then once we have their full range of motion, we'll move into strength, and then we'll move from strength into plyometrics, and then from plyometrics into adding in like sport-specific functional activities, and then fully returning them back to play or releasing them from their physical therapy. So we're going to start with the lower leg, foot, and ankle. All right, so one of the first exercises that you're typically going to see with any sort of ankle sprain or lower leg or foot injury to regain that range of motion is just going to be ankle pumps. So that's having them move through plantar and dorsiflexion. This can be good for individuals who have just sprained their ankle. It kind of helps with lymphatic drainage and getting that full range of motion back. One way that you can make this a little bit harder is then having them do, it's called alphabets on your guys' sheets, and this is just having them draw out the alphabet essentially. You can either have, usually what I have them do is have them go through the alphabet uppercase once and then lowercase once. And this just makes it a little harder than ankle pumps because we're adding in different directions. Obviously you see with certain letters we're getting a little bit of inversion and eversion, we're getting some circumduction. And then of course with any of these, one way to potentially make it more difficult, especially those ankle pumps, is adding a resistance band. So having her do a little bit of dorsiflexion with resistance. Okay, so once we started to progress them a little bit and they have a little bit more range of motion, we want to start working on a little bit of strength and a little bit of proprioception. So this is called the wobble board. And it's nice because you can move it in any direction. So you can still have them technically doing ankle pumps, but I like to generally have them do circumduction with this. So they try to hit all edges of this board to the ground without moving their knee too much. Obviously, as a clinician, you're watching out for any of those potential areas. I usually have people do 10 one direction or 10 clockwise and then 10 counterclockwise. Really to help, this helps with proprioception because they have to touch the board to the ground and be smooth with that, and then also just helps with range of motion. Another exercise that it can help with balance once they're weight bearing is they can do stork stands. So this is, you guys might know these more as single leg RDLs, but you can just have them do like a stork stand, and they kind of just then they can also come down and start to get a little bit of dynamic work in that way. And then a way to make this potentially more difficult is they can do this while trying to reach for something like a cup or pick up marbles and put it into a cup, anything that's going to make it a little bit more of a dual task. And then another thing that you can do, this is kind of for that lower leg as well as ankle, is just heel and toe raises. So coming up onto their heels and then lifting their toes. This again helps a little bit with proprioception, strength, and range of motion. So a lot of these exercises you guys are going to see that we're starting to hit multiple factors in one exercise, which is really nice because then you won't necessarily have to do ankle pumps and toe raises because you get a little bit of both in that exercise. Right, so another example of potentially maybe a little bit of an easier plyometric for the foot or ankle is just going to be line hops. So I do these a lot, and I just have them, I either draw a line on the ground or have them draw an imaginary line, and they can do just hopping over the line, little bunny hops. So hopping forward and backwards, having them potentially switch and then go side to side. That's just going to be a simpler plyometric than say like a jump squat. All right, so the next set of exercises I'm going to show you guys is for the knee. So again, keep in mind that I'm just showing you a couple of the more common exercises, especially the ones that are in your sheet, and then also that the ones in your sheet are not the only exercises out there. I'm just showing you common ones that I like to use and that I think you guys will see most frequently. But of course, and with everything, there's always more out there. So don't be too limited. If there's something that you want to use that I didn't show or isn't in your packet, and you think it's fitting for the scenario, say it's fitting to increase range of motion, you guys can obviously use those. Or if you have any questions about them, you can email me and just clarify any of those. So the first exercise to regain range of motion is just going to be prone hangs. So as you guys can see, we have our patient who is just prone on the table. You want to make sure their knees are far enough off that they're getting that full extension. Usually we see this in a lot of ACL patients who lose extension after their surgery. You can see obviously Bethany has full extension, but if we say had like a 5-degree loss of full extension, another thing that we can do is we can come through and we can just add an ankle weight around her ankle to kind of force that extension. Obviously she has full extension, she has a little bit of hyperextension, but if she wasn't fully extended, this would be pretty helpful in terms of just getting that range of motion back. All right, another common exercise that you see a lot of times, especially in post-ACL rehab, is heel slides. So a lot of times people don't have full function of their quads yet, and so this one can just help in getting back knee flexion. So you just have them use a towel, or they could even use like a jacket, and they just passively bring their knee into knee flexion. One way that you can potentially regress this is by having them do this on the wall, and then they have gravity helping them. But again, we're just trying to increase that knee flexion that can potentially be lost with any injury. Alrighty, as we start to regain our full range of motion and say they have full extension and full flexion, then we can start working on early strength. So one of the most common things you'll see is just a quad set. So this is just when they essentially flex their quad. So again, a lot of the times we see loss of VMO contraction after ACL. So this is just helpful in contracting the quads. Once they want to move into like a potentially more dynamic exercise, you can have them do a short arc quad set. So you can have them scooch all the way to the edge of the table and have them, it's essentially a quad set, but they have to move through a more full range of motion. So they would essentially come up and down. So you can go through even a little bit of the, like half of the arc, or you can go through the full arc. One way that you can make this more difficult is you can put an ankle weight around their weight potentially, or add some sort of resistance to them while they're coming up through that, but definitely make sure that they could do the full arc before you start adding any sort of resistance. All right, as we start to progress into more strength and functional movement, one thing that we really like to do is stool scoots. So this really activates the hamstrings, but you just kind of put them on a stool and just have them pull themselves forward. So I usually have my athletes do this in a hallway or potentially across the gym, but these are good exercises. If you want to have them go faster, you can have them, that could be potentially a progression, and then you can also have them push themselves backwards. Just make sure that they're being careful with that. Another strength exercise is a plie squat. So a plie squat is very similar to a normal squat, but I just wanted to kind of point this one out. A plie squat is anything where their feet are going to be slightly externally rotated. So to any degree, very similar to a sumo squat. A sumo squat is kind of under that umbrella of what a plie squat would be, but this activates the glute hamstring, or the glute medius a little bit more, as well as the groin. So you can just have them do a normal squat like this. It just targets a little bit different muscles. And then lastly is going to be a wall squat. I know everybody kind of knows what a wall squat is, but I wanted to talk about a couple of potential progressions. So regular wall squat, obviously they're just squatting. You can go for you could potentially do this for time, but one way that you could potentially progress that is have them squeeze a ball between their legs, put a resistance band around their legs, or put a Swiss ball behind their back and have them, and that kind of changes the surface a little bit. But those are all ways that you can change up a wall squat. All right, so for the last part of this lab, we're going to be going over just a couple of hip exercises that are pretty common in clinics, because the majority of hip rehab is very similar to your knee rehabs, to your ankle rehabs, and just the beginning of those strength exercises. So you can do a squat for a hip rehab as well as a knee rehab. So a lot of those are going to be similar. The only other two that I wanted to show you is an exercise called clamshells, and then just hip abduction on how to strengthen those, because it's kind of a strange exercise. All right, so this is gonna be the setup for a clamshell. You want them at a 90-degree angle with their legs and their hips, and then a resistance band above their knees. So what you're gonna have them do is keep their ankles together and then separate their knees against that resistance band. So you're gonna see a lot of people though tend to cheat, and they're gonna start to rotate and like shift their body. So you want to make sure that they're not doing that. A lot of the times I'll have people just put a hand behind their back and make sure that they aren't actually rotating. And I always say, even if it's just a little bit of motion, that's better than if they cheat to get more motion. The next one is going to be just hip abduction. So this one, you can remove the band. And this is kind of similar to how you would test adduction strength. So you kind of want to have them cross their top leg over and they're in kind of this position, and they're just going to lift the leg that's beneath and to really isolate the adductors. Again, you can add some sort of resistance band, or you can add an ankle weight to this to make it a little bit harder.